Como ustedes ven en las conferencias magistrales, vamos a tener el gusto de tener con nosotros al doctor jueves-11, profesor de dermatología clínica e ingeniería biomédica de la Universidad Northwestern de Chicago, y él es autor de numerosos artículos y capítulos sobre una variedad de temas con láser y sobre todo la investigación. Ha presentado innumerables conferencias en diferentes mítines y congresos, y él ha presentado sobre todo la interacción láser-tejido, que se refiere al rejuvenecimiento cutáneo, vascular, lesiones pigmentadas, cabello, grasa, pluma, láser, seguridad y otras aplicaciones clínicas. El doctor Garvey cuenta con patentes en el campo de la tecnología láser y ha contribuido al desarrollo y la aplicación de varios sistemas de láser. Su investigación actual de láser clínico incluye la regeneración cutánea, acné, la grasa, los vasos cutáneos, pigmentación del pelo y la eliminación de tatuajes. Él fue presidente de la American Society por la Medicina Láser and Surgery. Ha organizado y dictado conferencias en numerosos cursos de cirugía láser y simposios médicos en muchas partes del mundo. Es, sin lugar a dudas, el doctor Jerry Garden, uno de los más reconocidos expertos y una autoridad en cuanto a la tecnología láser se refiere. Yo tengo el gran placer de presentarlo y sobre todo agradecerle que hace muchos años tuve la gran oportunidad de estar en su oficina durante un periodo largo de tiempo, y eso nació precisamente ahí el conocimiento y el interés por estos temas tan interesantes con la tecnología láser. En esta conferencia magistral, el doctor Garden nos va a presentar complicaciones con láser y otras fuentes de luz, un hecho constante en la terapéutica. Adelante, Jerry.
Gracias, otra vez. Otra vez lo siento, yo voy a hablar en inglés, es más fácil para mí. The Academy asked me to speak about complications. I'm not here to scare anyone, because some of the pictures you will see are very scary. But I'm going to try to teach you what you can try to do in order to control the complications. So let's go ahead. First of all, every single time anyone uses a laser, whether you use them yourself or you send someone to get treated with them, every single time that laser turns on, there's a potential to have a side effect that the patient will not be happy with. If one uses lasers and they have not seen them, either you haven't looked closely enough or you just haven't done enough patients. Because everybody, myself included, everybody sees complications. This is a study that was just published in the Archives of Dermatology. They've changed the name now for those that know, they call it JAMA Dermatology. And they looked in America, there is the process of suing doctors. It's almost a sport by many lawyers that they chase doctors for almost anything. So what they did is they looked back over many years and try to look at all of the cases that people were sued. And they had found that 56%, down here, let me see if I can get this on again. It's not going on. Oh, there it goes. 56% were done by doctors, but all the doctors in every single one of the cases were sued. So even if someone else was doing it, if it's in your office and someone else does it, the doctor still gets sued, because the doctor has more money than usually the people who works for the doctor. And these were the things that you see there that they used to sue, that they had problems with. But it just reflects on what is done most. And there were burns, there were scars, and at least in America, what I found, 50% of the cases the doctors lost, 25% of the cases they settled, which means they paid for it, and 25% they lost. I mean, sorry, 50% of the cases doctors won, 25% they lost. So let's look at this. Why do we run into trouble? Why do people who use these machines get into trouble? First of all, it's just a matter of experience. Many of us who see CAD machines, and especially the first several months that you have this machine, I don't care how comfortable you feel, you really are unexperienced with it. I know I am, and I've been using lasers my whole career. So if you're able to, what happens then, during that period of time, use it very cautiously. Don't do difficult cases those first few times. Don't come back and use an expression in English. It comes back to bite you, which means you will regret doing it. Next, sometimes what happens is that they come to, at least in America, and I'm positive it must be the same way here, the companies come to you and they will give you, they want you to use a laser. Why? Because they want you to buy it. Or the clinic that you work at, or the hospital you work at. So what happens is the technician comes and he tells you what to do. Okay, because after all, we don't know how to use it if you didn't have experience, so he'll tell you what to do. But his goal is, of course, is to sell you that machine. That's what he wants to do. He wants you to buy it. So he will make certain that the results are good. If you don't see results, you're not going to buy the machine. So invariably, they always tell you too much energy. And what happens then is that you end up burning the patient. Now, the second you burn the patient, the technician is nowhere to be found. Okay, you're on your own. Okay, so whatever they tell you, whenever they come into me, whatever they tell me, I always divide in half. If they tell me to use 10, I always use 5. Because I just want to make certain I don't burn the patient, because I already know by then whether or not this machine works. So don't rely on these. Okay. And then sometimes it happens is that this is a truth that I've always done. If I have a patient in front of me, the patients are wonderful, as you know. What they'll do is you're looking at them and you don't want to treat them. Either they've had a suntan or they're the wrong lesion. You know you shouldn't treat them. And then they put what is called guilt. They tell you, no, I came from so far, you're not going to treat me. I read in the internet that you're supposed to do this, and you're not going to treat me. I've had patients scream at me, tell me, why aren't you treating me? I know you can treat me. And then, of course, in America, what they do is they immediately run to the internet and they give you a review saying this man does not want to treat me or something like that. So what happens is that you give in to them because, after all, you feel uncomfortable. If the patient traveled 2 hours to see you. So I always use a milestone. I say to myself, will I be able to sleep at night? If I'm afraid at night, I'm going to be worried that I shouldn't have treated, I don't treat them. And I just have to live with it, but then it's easy to do that. Another thing is that if you are treating, the last one down there, does the patient have more pain than usual? It's a real indicator. If you're treating these patients and then the patient tells you, oh my God, it hurts, what you immediately do is stop. You look at the machine, just make sure the machine is right. You look at the patient again. What has changed in the patient? You have to try to figure out what's going on because I review cases, unfortunately, for some lawyers, who find my name. And one of the things the patients will invariably say, it hurts so much and he didn't stop, or she didn't stop treating. So and also look at the skin. It's a little different. Other things, again, this is the most important things. The first 2 slides are the most important things. Then I'll show you all the bad stuff. What happens? We tend not to do test sites because the patient wants to have everything done. Oh, I have a wedding coming up. I have this coming up. And they put pressure on you. And they want you to do it. You have to step back. And if you really think not to, put test sites out. Which reminds me, I should just say, last time in my first lecture, at the very end, we started speaking about pigmented lesions, color lesions. And you should just know, and once again, catheter ray spots work only occasionally, and nevi, congenital nevi, I do not treat. Because I showed you that child with a lesion coming back. It's a waste of time. I don't treat. Now, I happen to be starting a new study now with another system. If it works, then we'll use that system. So far, I don't treat them with a laser. I'm sorry, it was just a sign that someone had asked me to just repeat that, but I was rushing it. Next thing on this list, number 2, is that when you put the numbers in for that machine, and you you want to treat them, go back once, twice, 3 times to make certain that you got it right. Sometimes I'm distracted. I think I put in the right numbers, but I'm talking to the patient or I'm talking to my assistant. That's a big thing. And next thing is, does the machine, is it new, or did they just come in to maintain it, which means to make it right? Even though it reads the exact same number it did before the technician came in to make sure that everything's right, it's almost always hotter. It means there's more energy there than that. And what happens if you think you're giving 10 joules that you were giving in the past, you may be giving a truer 10 joules. Before you were only giving 8 joules. And look at the atomic regions. I'll show you the neck, the chest, horrible areas. They scar all the time. You have to know the face, what the patient is most concerned about. The face is very forgiving. It's the neck and chest that burns like crazy. Look at the skin type. Did they get sun? You know, you look at them and you know the patient well, and they're 2 shades darker, and they swear to you they didn't have any sun. And you look at them, you know either they're lying or fooling themselves. And then sometimes machines that we buy, even they're very expensive, they don't do everything. And you just have to say to yourself, after the patient, I'm sorry, I cannot treat you. All right, so let's go quickly through these things. These are the old argon lasers. Before my time, and looking around in this crowd, before most of the people here's time. And it didn't have the right wavelength, so therefore it used to burn everybody. So what did we do? We went ahead and we wanted to shorten the pulse ratio. It means how fast is each of the spots on. So before, they used to be on constantly. That was called CW. It was continuous wave. And they used to burn the skin also. So we went ahead, and this is a patient that was treated with the argon, and she scarred on the neck. And then I went ahead and treated the rest of the neck with the pulse laser. Why was the pulse laser such a big breakthrough? Because it was the right color and was on for a very short period of time. When I had trained many, many years ago in Boston, at that time there was a world famous person called Joel Miller, plastic surgeon. He did argon laser, and also with Ken Art. And those were the people that I had trained with. But then when I was doing research on a pulse laser, it really changed things. But even with the pulse laser, you run into trouble. First of all, you have herpera, you can get edema, which is a lot of swelling sometimes, especially when we don't use the black. And you can get infections. This is a person who got a herpes infection right after even a pulse dye. When we're done with the pulse dye, it's rare for the skin to break. It doesn't make a difference. You can still see this. Thankfully, the patient healed well. And this is on the neck. Someone had used too high of an energy. And on the neck, is like I said, is not forgiving. And you have permanent hypopigmentation. This is very hard to treat. And this is something that I had happened. And this is when the laser broke. What happened is that you can see it has these little crescents, little what are called half moons here. What happened? On these lasers, you have a burst of freon, a burst of material that cools the skin. But the burst wasn't coming out well. It was lopsided. So it was too cold. So it actually caused, in this patient, which was skin type 4 or 5, it caused hypopigmentation. It just took a long time to go away. And the mother was not that happy. And you can get neovascularization. So even when you're using the right laser, you have to be careful. So that's why I said everybody gets it. The KTP, which is a safe laser, you can get scarring and hypopigmentation. And as I said earlier, the KTP is the #1 thing that I use for vessels around the nose. This is 532. It's the workhorse. If people are only going to get one laser, that's probably the best one to get if you have patients like that. But even that you can run in with getting problems along the nose. This is a thickened port line stain, a vascular mass. This is a thickened capillary vascular malformation. And you see with the hypopigmentation here, I'm able to shrink it down, but it turned chalk white. And then if you use this laser goes deep. It's great for big vessels. You can end up with little indentations along the nose here. Every single vessel that was done had this indentation. And look at this leg veins. Beautiful pictures. Especially that one. This is enough to make one not want to use a laser. But it was the wrong energy, the wrong type of laser on the legs. To switch now, there are lasers which are used for tattoo removal, and they're generally said that they're fairly safe. But these lasers put a tremendous amount of energy into the skin. So you can have blistering like this or like this, and these things tend to heal okay, but you get hypopigmentation. Even a safer laser, something called the ruby laser, which is you use very low energy, so you can get this is hypopigmentation on the because it happens in the chest area. So those were lasers that are used. So now the newer generation of lasers are lasers which allow you to go ahead and deliver the energy in a manner which looks like a geometric pattern of little dots that goes along the skin. And this way then you're sort of leaving surrounding areas which are untouched so they can heal. They can bring in, you can bring in then the keratinocytes to be brought in there from the rounded areas, and then what will happen then is you heal faster. So you would think that these machines are incredibly safe. So first let's just look at the old ones. These were the ablative. If you remember from the 1990s, people who came in had a lot of we would just peel off the whole top layer of skin. And they would go through this, they would work well. I mean, they were down for at least 10 days. And sometimes they would have tremendous amount of swelling. But what happened? Why did we stop doing it? They turned hypopigmented. It didn't happen right away. It took us 6, 12, 18 months to see it. It was called delayed hypopigmentation. And you can get hypopigmented, scarring occurred. Look at this. I mean, this was sent to me from Dr. McDaniel. You know, I do a course with Dr. Kenneth Art, at the American Society of Laser Medicine on complications. So we get all of these cases sent to us. So we have this whole collection of cases. I mean, this is, you know, this is not, you know, no one wants this to be their patient. And if you look at this, see the normal skin color here, and that's hypopigmented there. This man, he prides himself, at least in Chicago, as being the #2 malpractice lawyer in the city. You know, there's #1 that everybody knows about, but he's there. But he didn't, you know, he just wanted us to try to help, and we were helping. Here's another one. This woman could not open her mouth totally. And this is a recent case. This lady had pseudomonas infection. Again, these are non-fractionals. We'll get to the fractionals very soon. And you see you get hypopigmented. This is someone who had a herpetic infection. She needed to stay a week in the hospital. This is Dr. Arndt's case. And then you have what's called these micropeels. Maybe you have them here in Mexico. They do these very fine little peels. What happens though, if you have a skin type 4, 5, or 6, they hyperpigment. And this is a year later, and she's still hyperpigmented. All right, so let's talk about the fractional lasers. Can you run into trouble with them? And of course, like my first slide said, of course you can. And this is, we look here, she wasn't coming to be treated for this. This is what happened after she was treated. She had some little brown spots on her chest, and she came to me later, she says, look what happened. And this was from a fractional, non-ablative, meaning you don't poke holes into the skin, you just injure. These are thermal little columns that occur in the skin, so you don't lose the skin. And you still have this type of, look at the close-up, multiple areas of scarring. And even though this is supposed to be a procedure that within 2-3 days you tell your patient, oh, you're going to be back to work, you're going to be doing what you're doing, this is a month later. And look what happened to his areola lip. Look at it. It's gone. Did it come back? I mean, I don't know. This was sent to me by someone. And this is both non-ablative or ablative. This is a year later. Now we're going to ablative. Remember, this is the one now that makes the little holes in the skin. There's a CO2 ablative laser out in the technical exhibits here at this meeting. But this is a very commonly used laser. And here's a year later. This was sent to me by Dr. Bison out of Nashville. You can get hypopigmentation, hyperpigmentation, and then you can get scarring. You know, this patient came to me. She has underneath the eyes a very common area to do that. This is a year later hypopigmentation. And we were doing some new stuff that we presented. We're trying to get rid of hypopigmentation. I think for the first time we may be helping them. Again, this is ablative where you put it around the head. And then what